You know, CAR T-cell therapies have been very promising in hematologic malignancies, but in solid tumors, they remain quite challenging. There are a few CAR T-cell therapy studies looking at specific antigens in breast cancer, but those are really early phase studies with premature data. In regards to the macrophage-based immunotherapeutic approaches, they usually mechanistically depend on tumor-associated macrophages, which are prone to pro-tumor immunosuppressive M2-like phenotype, and they really lack the tumor-associated antigen specificity. So what we're working with here are genetically engineered human CAR macrophages to direct the anti-phagocytic activity of the macrophages against the tumor and to reprogram that tumor microenvironment, stimulating an adaptive immune response. So how we're doing this is by transducing the macrophages with an adenoviral vector that contains an anti-HER2 CAR. It's a highly efficient chimeric product where it delivers the CAR and at the same time it induces a pro-inflammatory M1-like phenotype. And these CAR macrophages have shown a antigen-specific phagocytosis and tumor clearance in vitro. And in 2 solid tumor mouse models, a single infusion of the CAR-M showed decreased tumor burden and prolonged survival in these mice. So based on this promising data, we have our first-in-human phase 1 study looking at the safety and preliminary efficacy of CAR macrophages in 18 patients with solid tumors expressing HER2. So what we're going to do is basically give these patients GCSF that will mobilize their monocytes into the peripheral blood for collection by apheresis. And then we're going to manufacture, prepare, and cryopreserve the CAR-M macrophage product. And then we're going to divide the patients into 2 groups. The first group will receive the product over 3 days in a dose escalating pattern. And if there were no dose-limiting toxicities, we're going to give the whole product in 1 day to the next group. Key eligibility criteria for these patients: they have to have HER2 overexpressing solid tumors, and they have to have failed prior anti-HER2 therapy. And our primary objective is looking at safety and tolerability of the product, in addition to feasibility of manufacturing the cells, and secondary objectives include clinical efficacy, so we're looking at overall response rate, duration of response, overall survival, progression-free survival. And the study has been recruiting at 4 sites, including University of North Carolina at Chapel Hill. And we actually have treated a handful of patients, and it's been going great so far with no identified risks. Probably towards the end of next year, we'll anticipate our first set of data. Yeah. I would say probably mid to end of next year.